The member from London West.
Thank you, Speaker. My question is to the Premier. While this government fails to show leadership to address London's mental health crisis, my community is looking for solutions, such as the innovative ER diversion project between London Health Sciences Centre, the CMHA Crisis Centre, and Middlesex London EMS. All the project requires is the Health Minister's sign-off to fund the EMS transfer of non-acute mental health patients directly to the Crisis Centre instead of to the hospital. The project would divert 3,000 patients a year and save $2.5 million annually, money that is desperately needed in my community. Will the Premier direct the Minister of Health to sign off on this project today?
Thank you. Premier, Minister of Health, Long-Term Care.
Thank you, Mr. Speaker. And as I mentioned last week in my response to this question, we have legislation in the province of Ontario. It's called the Ambulance Act. It pertains to the governance, the activities, issues of deployment, where individuals, patients can be dropped off by EMS. It pertains to all of the elements that surround our emergency medical services and our ambulance services. It would be a violation of the Act, Mr. Speaker, today to allow an ambulance to drop off a patient at a location other than a hospital. I know that one of the, whether it's a pilot project or otherwise, Mr. Speaker, I am looking very closely at this project. We were the government that funded CMHA to open and run this incredible crisis centre in the community. We are working very closely with all partners to see how we can further provide care to these vulnerable individuals.
Thank you. Supplementary.
Thank you, Speaker. Even if it were true that approving the pilot would be breaking the law, which it is not, this government has had 2 years to figure out how to make it happen. As CTV reported last week in London, the need for this diversion project has never been more urgent. LHSC's psychiatric ER is at 152% capacity, and 26 mental health patients are waiting for beds. Why is this Liberal government refusing to support the efforts that London is making to deal with this urgent and ongoing crisis?
Thank you. Minister.
Well, thank you, Mr. Speaker. And I'll state again that the LHIN, the local hospital, CMHA itself, my ministry, my office, myself, we're all engaged in conversations to see how we might be able to find a path forward, Mr. Speaker, but it would require a change to the Ambulance Act. One possible solution that was provided some time ago, Mr. Speaker, was if that crisis centre was actually to come under the corporation of the hospital, then it would be possible and it would be legal, Mr. Speaker, as has been done in other parts of the province, for that deployment and that drop-off to take place at the crisis centre. It was decided locally not to pursue that path, so we're looking at any other option that we can to make sure that that important service that we funded, that we started along with CMHA last year, that service is augmented even further.
Here.